Now with me in the studio is Iditoba Odumosu, Secretary, National Association of Nigeria Nurses and Midwives, Lagos State Council. And via Skype is Julie Mogbo. She is the Executive Director, Royal Nursing Consult. Good morning, Toba. Good morning, Julie. Thank you so much for joining us. Yes, we must thank you as nurses for standing in the gap, being that support, that backbone over the years, not just because of the pandemic. We saw the resilience of the nurses during the pandemic, but we must thank you for being that backbone to the health system. Thank you so much. You all deserve a round of applause. But let me begin with you, Julie. The pandemic opened our eyes to the challenges faced by those on the front lines, talking about the healthcare, those on the healthcare sector now. And the question, when you look at the reaction coming with regards to this Nurses Week, not everyone seemed to be in a celebratory mode. I wonder if that is same with you.
Well, thank you very much, Veronica. Great thanks to TVC for always bringing the nurses and amplifying the works that we do. And happy Nurses Week to Toba in the house. It's nice to have you here today. So, well, talking about celebrating the International Nurses Week, I think in this environment where I am now, I have witnessed lots of celebrations. So we had nurses in organized events in their hospitals, in their facilities. So they give out awards, they recognize those who have contributed in one form or the other, those whose services stand out amongst others. Well, every nurse needs to be celebrated, but of course you can't give everyone an award as a form of motivation. So what I see around me is celebrations organized by nurses within their facilities, and they're able to invite notable nurses from other organizations to be a part of it, either to receive an award or just to grace the occasion. I also have been part of events happening virtually, so organizations have been able to put together some events. There were nurses who had to undergo some competition. They were young nurses. So there's been some form of motivation because the pandemic, the year of the pandemic was declared worldwide as the year of the nurse and the midwives. And it was quite devastating when the pandemic broke out. So nurses were looking forward, after 200 years, they were looking forward to be celebrated. They were looking forward to have.
Right.
That didn't happen. So it kind of brought some form of demotivation. So, well, they're celebrating around here the best way that they can.
I like the word you used. It brought some sort of motivation, which is driving my next line of question to you, Toba. We've seen the fatigue, the feeling of despair, the helplessness, the challenge that nurses have faced trying to handle the pandemic. And the theme, part of the theme for this year is a vision for the future of healthcare. And so the question is that the challenges we have seen, would it be that bring about that pivotal change we seek for that sector, or we seek for the profession for nurses?
Thank you very much, Veronica, for that question, and thank you for having me. So I think from the theme of the year's celebration about the vision for the future of healthcare, it's taking in stock what has happened in the last year. Interestingly enough, the last Nurses Week was the theme was about nursing the world to health.
Yeah.
It was more as if it was preemptive of what was to happen. But I think one thing we can also understand is that the pandemic has been an era-defining situation, in the sense that we have an healthcare before this particular pandemic and one after it. So that's why I would believe that the ICN is trying to direct us towards how we want to build an healthcare that can address those new and emerging challenges that this pandemic has thrown up.
So do you think that with the challenges that we have faced in Nigeria, as nurses now, speaking as nurses now, that perhaps this will bring about the needed change for that profession?
Well, I think for the profession and then for the
building
organization,
the sector,
yes,
yeah.
the organization, we will continue to push for that. But I think another thing is that, one thing for sure is that it has brought in some investment, some attention to the health sector, and certain things are already being done. But at the same time, not enough has been done for what we call it, for the kinds of diseases and the kinds of things we might need to tackle in within the foreseeable future. So of course there is need for a lot more. But I am also quite positive that the government and policymakers and even us as nurses will take a cue from what has happened to shape certain things, to bring about policies and some directional changes. You understand? That would.
All right, and I will throw that question to Julie. Like Toba has, said here, Julie, that this has, thrown up some lessons, and he is confident that the government and those even at the helm of affairs will look at, carrying out some policies that will bring about that needed transformation for not just the healthcare sector, but also for the profession. And I'm wondering what areas you feel should be touched on or worked on moving forward.
All right, so thank you very much, Veronica, for that question. I really do desire to see the government be more proactive rather than reactionary. Even the actions that come as a result of an established problem isn't sufficient to say that we are working towards being able to competently cater or tackle the challenges that we are facing. We're looking at the area of training, for instance. I know I have said this a number of times. We want to have more investment in the training of nurses. We want to have the veterans who have retired, if we can push them into the educational system, can we have a curriculum for them modified to suit the dynamic needs? At this time, the world is speaking telemedicine. It is now that every nurse, it is expected that in the schools of nursing, colleges of nursing, conversations should have started on how telemedicine can be infused into their curriculum so they have that understanding. So in the aspect of education and training, these are the areas that I am looking at, that the government, policymakers, the stakeholders will pay particular attention to. That is one. Then secondly, the work environment. It is no longer news that nurses are leaving to Western shores and all that. Something needs to be done for our environment. We need to have an enabling working place. We need to have the right equipment to work with. We need to have a system that works such that people come to. If we need more hands, why can't we employ? If we're having challenges, can we work with the private sector to see how services can be rendered about healthcare being affordable, accessible? So is there a way we could partner with organizations to make healthcare accessible and affordable to people? The queues have increased. The queues in the hospitals they are alarming. So these are areas that I expect that the government will step into. Education, very critical. Then the working environment, making it conducive for both the health worker and the health care consumer.
And that brings me to the next question for you, Toba. How involved is your association with engaging with the private sector to see where areas they can partner with your association to address certain issues, the gaps that we have seen in the sector?
Yeah, thank you very much. So I think for us, as an association, National Association of Nigerian Nurses and Midwives, we always try to use our convening power to ensure that we negotiate, we collaborate with people in the private sector. During the pandemic, there was a lot of interaction and engagement with the private sector to get certain things done. And again, I think for us too, talking about the health system, we also are interested in in the political economy that we address the problems of the health sector with, in the sense that not just the private sector the government. We were very much interested in government having a lot of spending within the sector, understanding the kind of demographic and the wealth distribution and vulnerabilities of people. So apart from just private sector involvement, we're also always engaging with the government to ensure that they have an outlook on health that that favors social spending in that area, so that people, like Julie mentioned, that healthcare can be affordable. It has to be affordable. It has to be accessible to people, and some of those things have to be driven by government in some way subsidizing exactly healthcare.
All right. Quickly, Julie, before we let you go, one question that I would like to ask you is the fact that we commemorate this week on a yearly basis. Has it really translated into something substantial for the profession over the years?
Well, I would say yes, and I would say no.
Okay.
No, let me start with a yes. So yes, because we're becoming more enlightened, especially with the events that has been happening globally. Nurses get more enlightened as to what is possible, what is happening. The world has been digitalized, so you're able to see what's going on in other climes, and we consider what can be modeled here in our own environment. And no, because it's like it's still a long journey. It's a long walk.
Right.
There's still a lot to do, because we need everyone to come together to see what we can do. And we need a nursing council to rise to the occasion, improve on communication, let the people know what is happening. Let's know how we can be a part of it. Let there be that communal conversation tells us that, yes, we are working towards progressing and improving on the nursing profession as a whole.
All right, we'll leave the conversation here now. ID Toba Odumosu, Secretary, National Association of Nigerian Nurses and Midwives and Lagos State Council, and Julie Mogbo, Executive Director, Royal Nursing Consult. Once again, happy National Nursing Week. Thank you so much for your time.
Thank you very much.